Hi, my name is Monika Narain. I'm a junior here at IMSA and I'm originally from Schaumburg. Today I'm going to be talking about what I think is the most interesting thing in the whole world, the human brain. More specifically, I'm going to be talking about global brain health and how we can address this. Aside from neurology, which I'm a total nerd about, I'm really passionate about singing, running, and eating extremely dark chocolate. The best part of this TEDx experience is actually being able to give a TED Talk. I've been a huge fan of TED for as long as I can remember, and to be able to actually give a talk of my own is an absolute dream. So I'm really excited, and thank you for coming. There's a reason why they call it the IMSA bubble. For 9 months, these 96 acres are your entire world. You may go home for a day or two, maybe, but your thoughts are consumed by your essays, your friends, what you will do the second you step foot back on campus. And this world, despite the stress and competition, is absolutely beautiful. I have loved living and learning with so many bright, talented, wonderful people, literally 24/7, in our small, isolated, questionably constructed home. When I left IMSA last May for the summer, it was nice to not have to think about schoolwork or extracurriculars for once. In fact, all I could think about was the volunteer research experience that I was about to start at the Shirley Ryan Ability Lab in Chicago. Shirley Ryan is the nation's #1 rehabilitation hospital, as they'll so modestly tell you, specializing in stroke, brain injury, limb loss, cancer, and a myriad of other conditions. As a total neuroscience geek, this was like the biggest dream for me. I had the incredible opportunity to experience basic science research firsthand, and it was the best summer that I've had yet. I learned a lot during those 8 weeks about how the brain works, about cognition, about statistical analysis. But I also got to learn a lot about rehabilitation medicine, even though I never worked with any patients or clinicians. One of the unique aspects of the Shirley Ryan philosophy is that there's no physical separation between research and treatment. As I sat there typing at my desk, I got to witness speech, occupational, and physical therapy from just a few feet away. I saw patients who couldn't stand on their own or hold a pencil, patients who couldn't swallow or remember their name, patients who had traveled all the way from Mexico or Colombia or Iran. And it was such a humbling experience to watch them recover. And my bubble exploded. What really surprised me were the numerous international patients. Every time that I would step foot into an elevator, the cafeteria, or the lab, I would be welcomed by this symphony of languages, translators that assisted therapy sessions in Hindi or Spanish or Arabic. Thousands of patients travel thousands of miles every year just to get sufficient treatment at Shirley Ryan. And that got me curious as to what are rehabilitation services like around the world? The answer? Pretty non-existent. According to the Global Health Education Consortium, adequate medical rehabilitation is woefully lacking in developing countries. In fact, most countries don't even incorporate neurology into their medical school curricula. Let's take a guess. And for this, you guys can just shout out some answers, anything that comes to mind. Per 10,000 people, how many of those people do you think are physicians who specialize in rehabilitation? 2, 3, 6, 8. These are all some really good answers, but it's actually a lot smaller than you think. One study compiled data from 73 countries and found that the median number of physicians who specialize in rehabilitation per 10,000 is 0.1. And unsurprisingly, this is correlated with a significant number of years of life lost. But the worst part of it all is, these deficits don't just apply to the field of rehabilitation medicine, but the entire field of neurology. The lack of neurologists globally is absolutely appalling. Let's take another guess. Per 100,000 people, how many of those people do you think are neurologists? And again, you guys can just shout out some answers. Any more guesses? Okay, so the World Health Organization, which for the rest of this talk I'll just be calling WHO, compiled data on over 100 countries. Their results, on average, per 100,000 people, there are 0.91 neurologists. In fact, only 10.4% of the countries studied even incorporated a budget within their healthcare budgets to address brain illness. To make matters worse, in all of the low-income countries in the study, there were no pediatric neurology, neuroradiology, neurorehab, or stroke unit services available, nor any postgraduate training in neurology. As a result, the brain illness epidemic is worse than ever, and prepare yourselves for an even larger statistical dump. Neurological illness accounts for 12% of global deaths. Stroke is the second leading cause of death worldwide, and 1 in 10 people have a disability of some kind. 20 to 30% of the population is susceptible to brain disease, and some scientists say that when you take into account spinal conditions, neurodevelopmental conditions, and neuroinfection, the global burden of brain disease can be as much as 25% of the global burden of disease. Not to mention the 90,000 disability-adjusted life years, or dailies, caused by a result of neurological disease, which is more than any other type of disease. That was a lot. But unfortunately, that's not all. This burden is disproportionately prevalent in low-income countries. People from low-income countries represent almost half of the years of healthy life lost due to disability, or YLDs. These people account for 2/3 of the stroke population and 4/5 of the epilepsy population. The thing about stroke, disability, epilepsy, or other neurological conditions is that there's no one medication or treatment that can fix it. Who described it best? Public health specialists focus on the health and disease of entire populations, while neurologists usually treat one patient at a time for a specific condition. This can give rise to the common misconception that neurology is too specialized for global health efforts and can be better addressed through more general practices. There is a certain uncertainty when it comes to controlling non-communicable diseases, and public health specialists don't like that uncertainty. In addition, brain illness in particular is often met with stigma and discrimination, especially in low-income countries where they're not as well understood. 90% of children with disabilities in Africa, for example, don't go to school, are secluded within their homes, and shunned from their communities. And this is in spite of UN mandates on disability and education rights. The result is a vicious cycle of disability and poverty. On the one hand, people with disabilities are much less likely to find employment and be excluded from society, worsening their level of poverty. And on the other hand, poor nutrition, poor sanitation, and lack of access to medical care all worsen someone's disability. Fortunately, there are some viable solutions to some of these problems. Up to 70% of people could become seizure-free with the help of anti-epileptic drugs, which can cost as little as $50 per year per person. Administration of aspirin within the first few weeks of ischemic stroke, which is the most common type of stroke, can reduce risk of recurrence by up to 13%, in addition to being a cheap, accessible, and multi-purpose drug. Community-based rehabilitation, or CBR, has also been implemented in numerous countries as a multi-sectoral approach to improving the quality of life for individuals with disabilities. CBR can mean anything from medical efforts such as physiotherapy and assistive technology to social advocacy and awareness. It really depends on the place, the resources, and the people. CBR has been determined to be cost-effective by WHO benchmarks, beneficial in promoting social inclusion within the community, and is a globally recognized poverty reduction strategy. It all seems so easy, doesn't it? But that's not really what we're doing. who reduced funding by $24.6 million in the non-communicable diseases sector within the 2016-17 and 2018-19 budget. Among this, the disabilities and rehabilitation sector was cut by $200,000, and all sectors relating to brain health are among the top 10 lowest funded. The point of this talk is not to undermine the efforts of large organizations such as the World Health Organization, who seek to make the world a better place. Decisions like these are extremely difficult because we can't help everyone and have to do what is best for the most number of people. It's really not easy at all to just hand out a bunch of medicines or train some people. Rather, the reason I gave this talk is to encourage the conversation on global brain health. Unfortunately, this isn't a problem going away anytime soon. Even as we continue to better the health in middle to high-income societies, this increase in life expectancy is inevitably going to lead to an increase in neurodegenerative disease and stroke, while resource-poor societies will continue to suffer from neuroinfection, brain injury, and epilepsy. So in spirit of the theme of today's event, if we create just a little more space to implement more programs such as CBR, better the delivery of anti-epileptic drugs or aspirin, and incorporate neurology into medical school curricula around the globe, if we create more space in our national budgets to better understand the burden of these diseases and develop viable treatments, just think of the effect that we can have on global poverty, global literacy, and global happiness. Now I'm back in the IMSA bubble again. I am preoccupied by the thoughts of homework, friends, college, and a billion other things again. It's so easy as high school students to get lost in thinking about school and our own futures that we fail to realize sometimes that we're at least a little responsible for the futures of everyone else. And it's completely understandable. How are we supposed to solve the world's biggest problems when we're so stressed out for the next math test or SAT next month? How can we eradicate poverty and disease, living off our parents' allowance or a minimum wage job? So I encourage you all to create some space in your day to truly understand the problems that go on in the world. And honestly, this is more of a goal for myself, because I can't wait another 6 months till summer break to know about current events. We may not be able to fix everything overnight, or really anything overnight. But if we can at least be cognizant of the space outside our little bubbles, maybe we can get a head start. My name is Monika Narain, and thank you so much for listening.